We are going to be talking about calcium, the electrolyte in your bloodstream that we are concerned about today, and let's talk about the physiology and the mechanisms involved with calcium and the levels that are in your bloodstream. First off, we find the majority of our calcium, 99%, is in your bones. And so it is the largest electrolyte that we find in your bone system. But the 1% that we have is in your bloodstream. And it's a delicate balance. The normal range for it is the 8.5 to 10.5 in your bloodstream. And it's regulated by two hormone balancing processes. So it's always has a balance to try to keep it in that 8.5 to 10.5 range. The first is your parathyroid. Your parathyroid has a hormone, parathyroid hormone. That hormone is secreted when you need to increase your calcium in your bloodstream. So it is going to help to increase calcium in the blood. And how does it do that, this hormone? It goes to the bone and says, please help, we need some calcium back in. It can release a little bit to help with that. The other way it helps is that when you eat food, you have calcium in many of your foods, especially your dairy products, in your fish and items that have, especially if they have bones or they're from the sea. You find it in some of your green leafy vegetables and a few other things. So you get it in your food. I don't know if it's unfortunate, but 80% of what you take in is lost in your feces. It's the 20% approximately that is absorbed into your bloodstream. And the hormone that helps with this absorption is your vitamin D. And where do we get vitamin D? If you remember, it comes from your skin with sunshine, helping to form that. And it's also formed by your kidneys and helping to get that. So with the parathyroid stimulation, vitamin D helping you get some of the absorption also from your foods. Okay? So this is all for the purpose of increasing calcium in your blood. What happens when you get too much calcium in your blood? You need to get it lowered. And so your thyroid gives off the calcitonin. And your calcitonin is your other hormone on the other side that's going to work to decrease calcium in your blood. And it does so by kind of reversing the process. It causes the calcium to go back into your bone. It will kind of decrease the need for the absorption and may also communicate to the kidneys. We can lose a little bit here. And so that way brings that calcium level back down into our normal level. So that's how we keep a balance in your calcium levels in your body. So let's talk about that 1% that is in your bloodstream. Very, very important to understand that calcium has two forms or ways that it is transported in your bloodstream. First way is that it is bounded. And what is it bounded to? It is bounded to albumin. Okay? The second way it's transported in the bloodstream is what we call ionized. Ionized is the free-floating, available for use, and this is the one that we are concerned most about because this is what provides the functioning that calcium has within our bloodstream to the various organs that it works with. Okay? So let's talk about that 1%. And of that 1%, 50% of that is bound to the albumin, and 50% is bound or is free and ionized. And so when you get the calcium level on your chemistry in the hospital, it doesn't separate the two. It's possible the doctor could order a separate lab of ionized, but that's very rare, and oftentimes they don't need to on adults. But again, our goal is to get the, is to get the 8.5 to 10.5 range. Unfortunately, if you have a problem with your albumin levels, it can change what your level in the entirety is going to be when it comes out on your patient's lab. And so we need a way to figure out when we have a person that has a change in their albumin, and most likely lowering of your albumin, what does that do, and how do we know that we have enough ionized to do the work that calcium has? And there is a relationship between albumin and the amount of calcium that's found in your bloodstream. And the formula is for every 1.0 drop in albumin, there is an approximate drop of 0.8 of calcium. So it's almost a one-to-one relationship, but not quite. So let's talk about what this means. Let's say that we have a patient that has an albumin of, let's put it 2.5 for our patient. And let's say that they have a calcium of 7.8. And our question is, with the 7.8, do we have a patient who is abnormally low? And again, our question is, are we dipping into the ionized? Or is this level because the boundedness has gone down, which is okay. It's not a harm to the patient. So we have to use our formula to figure this out. What are we looking at in relationship to this calcium and this albumin level? And if you remember correctly, this up here, we have a 1 point drop to 0.8, okay? And we have here, let's say, 2.5. So our normal albumin is 3.5 to 5.0. Now some say to take it at a 4, but I'm going to take it as a drop from the low one, the 3.5. So that is actually a drop of 1. And having dropped down here, 2.5 from 3.5 is 1. So that means we have an approximate 0.8 drop in our calcium. Well, what do we do with this 0.8? If you take your normal range, 8.5 to 10.5, excuse me there, and we minus 0.8, we come up with 7.7 to 9.7. This 7.7 to 9.7 is now our new range of calcium normal for a albumin of 2.5. So the 7.8 is now considered to be normal for this level of albumin. And as a result, we know that the patient is safe with their ionized amount. It's the bounded that was lost. And we don't look at this as being abnormal for this patient in this scenario. All right, so we talked about bounded and ionized. And why is ionized so important? Well, you have to understand or remember what the job is of calcium. And the job of calcium has to do with your muscles. So to get your muscles to move back and forth, they need to have calcium. And so calcium is important, and you'll see on your patients that have abnormal calcium, it is affecting muscle movement. And when you have too little of calcium, you will not have the muscles being able to move. They actually become paralyzed. So if you want to think of it that way, they become, in a sense, paralyzed. And we have to worry about certain muscles in your body that have movement and need to move. Besides your skeletal muscles, which can be affected, we also are worried about your respiratory system and your muscles to breathe. We are also concerned about your heart and your heart being able to beat. And so these are very, very important considerations when calcium levels get too low. On the other hand, when calcium levels get too high, it doesn't make you hyper or anything. It actually, it's like it slows everything down. It makes it too sluggish, it's too full, it's too much for it. So everything becomes weaker. It weakens the muscles, and so they don't move as well. And then you also are concerned about not only your skeletal muscles, but your heart and your respiratory system, breathing and all. So that's the problems with ionized getting out of balance in our patients. Talk about how we treat someone with hypocalcemia and hypercalcemia. And in order to talk about the too high or too low levels of calcium, we need to go back to our balance system that we talked about earlier. And we're going to be manipulating this balance based on what the need is in our bloodstream to keep our calcium between 8.5 and 10.5. So let's first talk about hypocalcemia, too low of calcium. How can we get their calcium back up? Well, let's talk about first, we could increase their food intake of calcium in the dairy products and other types of foods. But again, that's kind of hard to bring up somebody's calcium level just by food. So most of the time, we need to add supplement pills of calcium that the doctor can order on top of that to help try to increase the availability of calcium in our gut to get into our bloodstream. If we need to elevate our bloodstream amount quicker than waiting for the GI tract, we can give an IV of calcium, and the form that we use is calcium gluconate. Calcium gluconate is the drug of choice. It's a very potent drug. We have to be careful with it. It can be given in an emergency situation if the calcium is so low that our heart is stopped. And asystole, it's a commonly used emergency drug for restarting the heart. In this case, we're hoping to use it to start elevation of a lower calcium level and bring it up at the correct amount in the right rate. So we want to make sure that we're not overdoing it. It's possible if you give it too fast and a patient is on digitalis that we might elevate their dig toxicity can occur. So we want to be careful about that, make sure we give it at the correct rate. The other thing to consider with too low of calcium is again the tetany, the paralysis that was going on. And we want to make sure not only their heart is working, but the respiratory system. So you might have to have a trach starter kit at bedside in case the doctor needs to do an emergency tracheostomy on the patient and get them on a respirator until we can get their calcium level back up into the normal range and level. So those are the ways we help bring calcium levels back up when we need to. Let's talk about too high of calcium, the opposite of too low. So it's very rare to find a patient that has too high of calcium. Many times they have some sort of a bone metastases, cancer in their bone or something that would cause you to have too elevated, among other things. But let's look at what we can do to manipulate this to bring calcium levels down. Of course, we could have a decrease of food intake, but that's usually not as much the culprit. But we want to try to stop or decrease the absorption in the GI tract. So one of the things is we can give steroids. Steroids actually compete with vitamin D in the gut, and that will help to decrease the absorption that way. Another way is to IV, put it over the kidneys, normal saline, and we're going to flush some calcium out through the urinary tract. We do lose a little bit of calcium through there. We have to be concerned when we're increasing amounts of calcium through the urinary tract that we could run into the problem of kidney stones. Very commonly, stones are made of calcium as the substrate to the stones, so we have to be careful about that, but it is one of the ways to help bring it down in the bloodstream. Another way to help bring it down in the bloodstream is to use our calcitonin. We do have it manufactured as a drug and can be given to help lower the calcium by depositing it into our bone. Another way to help with bone and bone deposit is to use phosphorus. And phosphorus, if you remember, is in an inverse relationship with calcium. So as calcium goes up, phosphorus goes down. As phosphorus goes up, calcium goes down. And we can manipulate calcium, at least temporarily, by using some phosphorus. And the drug of choice would be sodium or potassium phosphate. Okay? So that can be given IV to our patients to help temporarily bring down that levels of calcium. Another way is to remove the parathyroids, if that seems to be the culprit of why. So if somebody has a parathyroid problem, hyperparathyroidism, that's the solution, is to get rid of those little parathyroids, surgery. And then another way to consider keeping it within your bones is to get your patient up and ambulating. Remember that weight bearing does increase the deposit of calcium into your bone to strengthen your bones, and that's another way that we can help our patients with hypercalcemia. So those are the ways that we manipulate calcium to bring the levels down for